Hi all. So today I'll be discussing the topic regarding ABG. What is the purpose of ABG and why we are doing the ABG in the ICU setting? So the ABG is usually the blood test which will be taken from a artery, radial artery, or from the wrist or the femoral. So to assess any oxygen status and the oxygen therapy or any ventilator status, also to check out the lungs or removing it properly of carbon dioxide, and it also detects for the any respiratory failure and metabolic acidosis, alkalosis, and if the patient is having any sepsis and the elevated lactate, and in conditions like a COPD, asthma, renal failure, and cardiac arrest, sepsis, and trauma. So for these all conditions we are monitoring the ABG. In ABG, what are all the lab values we are monitoring? The one is pH and PCO2, HCO₃, and PaO2 and SaO2. So what is the normal value for those lab values is? The pH is 7.35 to 4.5, and PaCO2 is 35 to 45, and HCO₃ is 22 to 26, and PaO2 is 80 to 100, and saturation is 95 to 100. So for ABG monitoring, the PaO2 and SO2 is not needed to interrupt the alkalosis or acidosis. Always remember the pH is less than 7.35 is acidic and more than 7.5 is basis. And in bicarbonate, less than 22 is acidic and more than 26 is basic. In CO2, PaCO2, more than 45 is acidic and less than 35 is basic. So the always CO2 is regulated by the lungs, and bicarb is always regulated by the kidney, and the compensation is lungs will be compensates fast and the kidney will be compensates slow. If the patient is having hyperventilation, that will lead to decreased CO2, means alkalosis. Hypoventilation, increased CO2, that is lead to acidosis. In kidney, excretes excess of hydrogen ions into the urine or reabsorbs excess bicarb from the urine back to the blood. This is the mechanism. Always remember the mnemonic is Rome. The respiratory will be opposite and the metabolic will be equal. I hope in this video I have overview the ABG and the sites and the purpose and the compensation and the mnemonics, how you need to remember. So do follow and subscribe for more videos. Thank you. Bye bye.